gunshot wound back in the head.
From combat field hospitals in the Middle East to the front lines of the COVID crisis here at home, Stanford doctor and Air Force Colonel Dean Winslow has been leading from the front throughout his medical and military careers. Now, at the height of the COVID crisis, he shares his personal and professional leadership lessons learned we all can learn from to safely get us on the other side of COVID. As part of the Marines Memorial Association's tradition of honoring commitment and sharing timeless leadership lessons learned in all walks of life, the conversation continues in this online extension of what normally takes place at the Marines Memorial Club, a public, nonprofit hotel, theater, restaurant, and event space in downtown San Francisco, serving generations past and generations to come for nearly 75 years and counting. I'm correspondent Mike Cerre, and this is Leading from the Front. The personal opinions expressed here are those of the speakers and not necessarily those of the Marines Memorial Club. Dr. Dean Winslow, thank you for coming back to the Marines Memorial Club, albeit virtually, to help us deal with one of the most important topics that's on everyone's mind, how we're fighting this battle against COVID.
My pleasure, sir.
After 6 combat medicine tours of duty in Afghanistan and Iraq, 35 years in the Air Force, did you ever think you would be back on the front lines of a crisis like you are right now down at Stanford University in the ICU unit for COVID?
Yeah, I honestly did not, sir. But I'd also like to point out that, to quote my dear friend and someone that I look up to, General Mattis, is that, it's been an honor to serve. And I think Jim, when he's thanked for his service, he always said, well, you're worth it. So that's what I'd like to say to everyone watching this video. So again, it's an honor.
We talk a lot in military terms in describing this crisis. We talk about the surge we're going in. We're underway right now, this being recorded the middle of January. Is it hyperbole to equate this COVID crisis to war and battle?
Well, I think it is and it isn't in many ways. So I think some of the analogies are that it really is an all hands on deck effort. The thing is, we discussed briefly yesterday, Mike, that I find inspiring is just the dedication of all of my colleagues, not just fellow physicians and the house staff, that's the interns and residents, but our nurses and respiratory therapists and physical therapists and all of the people that really make healthcare possible, at a academic medical center like ours. So again, from that standpoint, I think there is a certain analogy that's appropriate.
You were saying that you're taking patients from all over the state that are, because their capacity has been run out on ICU beds and whatever. Is it kind of like when you were running a forward medical base, an EMED or a CAS unit, that casualties were coming in and you had to disperse them to different places fairly regularly and quickly?
Yeah, so again, I think at least in Iraq, we had a very, very efficient system that was run by the U.S. Army called the MRO, or Medical Regulating Organization, that I thought did an excellent job of, making sure that no single facility was overwhelmed, let's say with a complex attack on a convoy or something like that. I think we're actually learning as we're going through the process here in the state of California. But again, we do have still at this point a little bit, but very, very little excess capacity right here at Stanford. So I'm very proud of our institution for stepping up and being willing to take patients from the Central Valley in Southern California.
Did you think at this stage in your life and your career you'd be stepping back into the hot seat of an emergency room with things happening very quickly and working long hours and trying to rally teams to do sometimes nearly the impossible?
Well, again, I feel actually very honored to be able to do it. I'm also very lucky that even at age 67, that I think I'm still physically fit, and I really love being a doctor. It was what I always wanted to do. So, to me, this is, where I should be right now.
Do your civilian colleagues look to you for an added degree of leadership based on the very difficult situations you've been in through most of your career and in your ability and experience with dealing with a crisis?
I think maybe they do. And again, it's something that I don't talk about a lot, but one of the things that I try to teach our younger doctors is just number one is, take the job seriously and the mission that you have seriously, but don't take yourself seriously. So, there's also, I think, a lot of humor and, positive reinforcement that we give to each other on the team. So, from that standpoint, it is a little bit like being downrange where, there is this feeling that we're all on the same team and we have this mission that's much greater than ourselves.
Do the same leadership skills apply here? Working as a team, selfless service, take care of your people. Is that even more important in the situation you're in now?
Yeah, I believe so. And again, don't want to sound like I'm tooting my own horn or anything, but for all the jobs that I've had, I've always tried to lead from the front like an officer should, and not ever ask my subordinates to do anything that I would not be willing to do myself. So I think from that standpoint, there are certain similarities with military service. And again, I think being honest and but also showing people that you care. One of the things I remember again hearing Jim Mattis say at a lecture that he gave at Marines Memorial just a couple of years ago, which really surprised me. In a way, coming from, frankly, the finest combat leader really of our generation, was that Jim was talking about leadership, and he said basically that one of the most important things that he learned is that your men and women have to know that you love them. And so I'm using that, in the larger sense that, we respect each other, and people do need to know that you really care for them as human beings, not just cogs in a big piece of machinery.
But leading from the front over 35 years in the military, it seems like you have a real penchant to get yourself in some hot spots. You've been everywhere from Hurricane Katrina to helping folks out in New Orleans to Antarctica to McMurdo Station. Is this what you thrive on? Do you thrive on these challenges?
Well, I do, sir. And again, I feel very fortunate to have had the experiences that I've had in life, and also, the support of wonderful people, including my parents and my wife. Again, I feel that really it's been an honor and privilege to have many of these experiences.
And what drew you to general medicine or the military? Which came first?
I think really all of the above. And, of course, my dad served in the Second World War, as did everyone, in that generation that came before us. So again, I think always have been attracted to military service from that standpoint. Also, I became a pilot when I was 14 years old, and so I always loved aviation and and also I love science and always wanted to be a doctor, take care of people. So I think I really hit the jackpot by becoming a flight surgeon. Since I got to fly as a crew member in supersonic jets, and also take care of my colleagues and be a doctor, and then later on, of course, having the wonderful experience of being able to lead wonderful medics, downrange. So I could not have asked for a better life and a better career than I've had.
Have there ever been any kind of general disconnects or philosophical disconnects between being a military person and being a medical professional, having to merge those two roles in one job?
Well, fortunately, in our armed forces, there's a very clear distinction, between our role as medics and medical corps officers and being a line officer. One of the things, though, frankly, that I've enjoyed, particularly about being a flight surgeon downrange, was, being someone, who could be an advisor or a confidant, to a commander. But I've never been put into a position where, I felt that there was an ethical conflict. And again, one of the things that I also felt honored to do was to care for detainees, in our custody and in Iraq, particularly. Because again, I think this was a way that we actually showed our adversaries who we were as Americans, and that we stood for integrity and kindness and fairness. So fortunately that, I've always had commanders and leadership that have supported this vision as well.
So how do these skills as Lieutenant Colonel Winslow translate to Dr. Winslow, the vice chair of the Stanford Department of Medicine, and then taking over a major county hospital in Santa Clara? a lot of people, a lot of moving parts. Were the skill sets you learned in the military pretty applicable to those situations?
Absolutely. But again, I think it was more the general principles of, how do you lead, from the front. And again, I think one of the things that I look back on, and the various jobs that I've had both in the military and on the civilian side, is the fact that people still talk to me, and we still are always very happy to see each other. But those are the kinds of, I think, lessons that the military teaches you.
Did that help you during a particular crisis when, while you went on vacation, some administrator fired most of your staff without telling you, and for what turned out to be kind of a bogus reason? But you stood by your team.
Yes, sir, I did, and very proud of that. And again, I think one of the things that I don't want to really sound like I'm tooting my own horn, but there certainly were times, in particularly in that job, where obviously, all of us, we want people to like us. And of course, last thing we want is to be fired from a job. And I just kept thinking, well, gosh, if you've done that and you've come through it, are you going to let, someone who's being really unfair, cow you into silence? So, that's really, I think what I lean back on was, I did not want to really disgrace myself or disgrace, in a way, my colleagues that had supported me.
Now, sometimes people outside the military confuse orders in the chain of command with some kind of blind obedience that restricts your individual character and moral judgments to come through. You were in a fairly contentious Senate confirmation hearing for a really good job, the Undersecretary of Defense for Health Affairs, and spoke out very plainly about an issue that probably cost you the job.
Yes, sir. And again, I'm not going to, blame anyone else. I take full responsibility, I think, for my honesty. Part of it was I was actually, if you listen to the whole testimony, I was sticking up for my United States Air Force, which I thought was being blamed unfairly for the veteran, who clearly had mental problems, who had gotten access to an assault weapon and killed 26 people at a Baptist church in Texas. When I may get in trouble with other members of the committee, just say, how insane it is that in the United States of America, a civilian can go out and buy a a semi-automatic assault rifle like an AR-15, which apparently was the weapon that was used.
With all the leadership challenges the country is facing now, do you think that the national leadership problems with dealing with COVID are probably the most apparent and really the most time sensitive at this point?
I do. I think that we have a very limited amount of time, and as you and I discussed, preliminarily last night, one of the concerns I think most of us in the field of infectious diseases have is just how decentralized our approach was to managing this pandemic. Unfortunately, the Centers for Disease Control, I feel, was to a large extent pushed to the side, whereas really they should have had a critical central role in coordinating our response throughout the United States. And instead, basically, it was put out to individual states and county health departments, some of which did a wonderful job, but in other places, they were not supported by their local political leadership. And we're now still paying the price for that with this really awful third surge of COVID-19 cases that we're still in the midst of right now.
Now, distributing the leadership responsibilities out to the states, was there any practical elements to that from the outset, or was it, do you think, kicking the can down the road or pushing it out on somebody else?
Yeah, I think there was to some extent a very kind of a cynical view that the administration did not want to be viewed as the bad guy. There was also, they were getting a lot of bad advice from people who clearly were on the fringes of thinking that basically COVID-19 was overrated, that it wasn't as nearly as serious a disease, that the cases were inflated, and that you could allow things such as natural immunity occurring, which clearly is disastrous, in a disease that has about a 1% mortality rate. So again, I think it was a very cynical and unfortunate decision to basically not take charge of this at a federal level, and again, just basically let states and counties struggle on their own to try to deal with this terrible pandemic.
During your military career, was there ever a situation where you had to defend science for one of your decisions with a commander who was thinking in completely other terms, and that you had to kind of really confront him or her with science?
Fortunately, Mike, I was very, very fortunate. I had, without exception, wonderful commanders during my 35 years in the military. And I always felt that people listened to me and my staff. So again, I really did not have any negative experiences, in that line at all.
But over those 35 years, you're kind of well aware of just the simple leadership skills and decisions that can have a big impact on the big picture down the way. I can remember commanders making us change our socks and shave out in the field, and we could never figure out what was the real backing, what was the real reason for that. But there was a knock-on effect to it. And is that kind of the same way with masks? If you just start with wearing a mask, may the other benefits generate from there?
I agree. I think that, that's a really great analogy. And one of the reasons why really all Americans, should wear a mask, and particularly people that are in leadership roles, is that it sets the right example for really what all of us need to be doing. And again, until about 75%, or even some people are saying a little bit higher percentage of the population receives immunity from COVID-19 through vaccination, it's going to be very, very important that we continue these physical measures, such as mask wearing, social distancing, and avoiding indoor get-togethers.
And even if it's later to be found that scientifically that wasn't all that important, do you think it's symbolic of individuals being responsible for doing something to contribute to the solution?
Oh, absolutely. And actually, though, from a scientific standpoint, that wearing face masks or face coverings not only protects others in case you happen to be asymptomatic and shedding the virus, but it's also been shown more recently that wearing a face covering actually protects the wearer as well. So again, it's very effective in dissemination of these small particle aerosols, which we now realize are the most important way that this virus is transmitted. But I think, your bigger point from a leadership standpoint, Mike, is that it sends the right message. And that's why it's just so important that our nation's leaders, and as well as, people in positions like mine, set the right example by following these principles.
Doctor, I think we all agree that some of the best profiles in leadership come from a crisis like this. So we've talked about what didn't work on the leadership basis. Let's talk about what was working. What do you think is a great example of leadership throughout this crisis? An individual or some activity?
Honestly, I think that, again, he's been singled out by many other people, but is actually an old friend and colleague of mine, Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Disease. I think he has spoken the truth, and he's done so in a respectful and very clear way right from the beginning of this crisis. So I think at this point, I'd have to say that the one person that I would identify my hat is off to is Dr. Fauci. He's been a tremendous leader. He's not only an excellent scientist, but has also been really a wonderful leader in all ways of the NIAID since he took over as director in the mid to late 1980s. I think he's a real giant in many ways. And again, another person whom I've been friends with for a number of years is Dr. Cerre, who is our public health officer in Santa Clara County. And again, she and her department really issued the very first stay-at-home orders earlier this year. And then later, other counties in the Bay Area, and then finally the rest of the state of California fell into line as well.
What about the CDC and Dr. Robert Redfield? How do you rate his leadership through all of this?
Yeah, it's a little tough to assess, and again, to put the caveat out there that actually I've known Bob Redfield also since the late 1980s, and we collaborated extensively back in the early 1990s when he was at Walter Reed Army Institute of Research on HIV, and I still consider him to be a friend. And I think though Bob was put in a very difficult situation at the CDC, and again, many of the things that I think he knew and the people working in the Centers for Disease Control knew what needed to be done, he was overruled. I think one of the most egregious examples, which was reported in the press, was when the CDC issued guidance, and then the White House basically edited it and essentially changed the guidance against the recommendations of the CDC. So I think they were put in a very, very difficult situation.
But Dr. Redfield was also military, spent 10 years in the Army as a surgeon and doing medical research, did his internship or his residency at Walter Reed. Do you think this has really challenged all the leadership lessons he learned along the way?
Yeah, I'm sure, again, it was very, very difficult for him. And again, I don't want to criticize him because I'm not, privy to the conversations that, took place or the communications between the White House and his office. But, let's just say I think he was put in a very, very difficult situation. Again, I probably personally would have resigned at some of the things that, he was asked to do or not do.
When we see other members of the Corona Task Force, we see uniforms, but that's a little bit misleading. Jerome Adams, who's head of the top Surgeon General health officer in the country, wears a uniform, has the rank of a vice admiral, but did not serve in the military.
That's correct. So the Public Health Service, though, again, is one of our uniformed services, although they're not military service. But again, the Public Health Service, goes back to fairly near the founding of our country, and traditionally that they provide medical care for sailors and seagoing people.
Well, one military man has really been walking point on this and catching a lot of heat, a lot of shots, is General Perna of the Army, a four-star general who's in charge of just getting the vaccines out to the country. I think that is probably one of the most visible leadership roles right now in this crisis.
Yeah, and I think he's done a really good job. But again, he's been put in a difficult situation since he really, can only reach out so far and, get the vaccine out, to healthcare systems and hospitals, et cetera, as well as state and local public health departments. So he has no control, though, sort of once the vaccine leaves, the manufacturer.
And he seemed to have demonstrated a very important leadership lesson by taking responsibility when things didn't go right on the initial rollout. He didn't equivocate. He didn't kick it down to somebody else. He stood right up there and he said, I failed, I'm adjusting, I'm fixing it, and we'll move forward from there. But he didn't duck and cover.
I agree, and I really respect him for that. And again, also the fact that he and others, throughout this crisis have shown, a great deal of humility and willing to sort of change course. And, we have a half-hearted, funny expression that we commonly use in the Air Force, that flexibility is the key to air power, and sometimes indecision is the key to flexibility.
And rather than putting the onus on leadership here on public officials, health officials, government officials, and whatever, do you think this is really an individual responsibility? That talking about leading from the front in COVID, is it important that we all lead from the front in our families and our workplaces and whatever, if we're ever going to get this thing under control?
No, absolutely. And again, until, a good 75% or so of the population receives the vaccine, I think it's very, very important to avoid particularly indoor gatherings. So really, in my opinion, no one really outside of your nuclear family really should be getting together indoors. And, as much as I love going to the Marines Memorial Club or just going out to a restaurant or a bar, with friends and family, it's not the right thing to do. And of course, we paid for that very dearly by, I think, opening up the economy way too soon this past summer. So, again, I think, as you're alluding to, that it's very important that all of us as Americans do the right thing.
Are vaccines giving us a false sense of security What do you think the timeline is to get to that goal of herd immunity where the country is relatively safe?
So again, unfortunately, as you pointed out, the rollout of vaccines, has been much slower than we would have liked, for a variety of reasons. But the estimates that I still hear, in the lay press are that by the late fall, close to 75% or so of the population will have had the opportunity to receive the vaccine. And again, I'm really hoping that that there's not, a huge sort of anti-vaxxer concern, because again, that could really adversely affect our ability to get this pandemic under control.
As tough as this has been on you and your family, working these long shifts, dealing in the ICU, all the emotional aspects that go with that, in a way, is it somewhat re-energizing you as to what you set out to do in life as a doctor and as a military person?
It absolutely has been energizing. And as we talked about earlier in the interview, that, I've never, at least not since probably the early days of AIDS, felt, such a commitment to a cause and dedication to basically, helping lead at least my small team from day to day to care for patients and to take care of each other.
Well, I'll tell you, I know you and your wife, Julie, are frequent flyers when it comes to the Marines Memorial Club. You said this was kind of your favorite getaway weekend place to come up. And when was the last time you were up here?
Actually, it's probably been 2 years ago now. I think, again, we stayed there in the fall of 2018 when the infectious disease conference was up in San Francisco. So it's been a while. Then, of course, last year, we were in Antarctica for 6 months, but we really miss it. And so selfishly, that's another reason we want to get COVID behind us, is so we can come back to the Marines Memorial Club.
Well, Dr. Winslow, thank you for your service in the military all those years and your leadership there, and now continuing that leadership in a very difficult situation for the country. We really appreciate what you're doing.
Mike, you're really welcome. And if you don't mind me saying, I'd like to go on record, though, as thanking you for your service as a Marine Corps officer in Vietnam, and then also for the great work that you've done as a journalist over the years.
All right. Thank you, Dean. I really appreciate that. And looking forward to seeing you back up the club.
Thank you, sir.
For more information on Leading from the Front and how you can support it and the Marines Memorial Association with your tax-deductible contribution during this challenging time, go to ourmission.marinesmemorial.org/lead.